In life, there are organisms we see and share life with. And then there are tiny creatures that share life with us and we don't get to see. These are the bacteria. One of these billions of bacteria is Pseudomonas aeruginosa. Pseudomonas aeruginosa is widely distributed in nature. It is a gram-negative rod. Almost all strains are encapsulated, motile by means of a single polar flagellum and several types of pili, all of which are usually located at the same pole. It may colonize healthy humans without causing disease. Since their discovery during the 20th century, antimicrobial agents have substantially reduced the threat posed by infectious diseases. These gains are now seriously jeopardized by another recent development: the emergence and spread of microbes that are resistant to cheap and effective first-line drugs. The medical community has been witnessing a growing epidemic of infections due to gram-negative bacteria resistant to many classes of antibiotics in most countries of the world. And the Pseudomonas aeruginosa is a clinically troublesome gram-negative opportunistic pathogen that causes a wide range of infections and a major cause of HAA outbreaks, especially among highly susceptible patients, and to a lesser degree, outpatient healthcare. One of the most worrisome characteristics of Pseudomonas aeruginosa is its low antibiotic susceptibility. Resistant hospital-acquired infections are expensive to control and extremely difficult to eradicate. Pseudomonas aeruginosa causes urinary tract infections, respiratory system infections, dermatitis, soft tissue infections, bacteremia, bone and joint infections, gastrointestinal infections, and a variety of systemic infections, particularly in patients with severe burns and in cancer and AIDS patients who are immunosuppressed. The case fatality rate in these patients is near 50%. Pseudomonas aeruginosa is responsible for 16% of nosocomial pneumonia cases, 12% of hospital-acquired urinary tract infections, 8% of surgical wound infections, and 10% of bloodstream infections. The high mortality associated with Pseudomonas aeruginosa infections, particularly in immunocompromised patients, and the excess morbidity and mortality associated with ineffective empirical therapy in these infections. To prevent this problem, please be careful with using antibiotic treatment. And remember, the more we use these drugs, the more we increase the speed of emergence and selection of resistant bacteria.